Dr. Aman, a kidney transplant surgeon in New Delhi, India, has created this video for educating kidney transplant patients. Organ transplantation is truly a medical marvel. But with this second chance comes a lifelong commitment to taking care of your body, and that includes being mindful of your diet. Now, we all know fruits are a cornerstone of a healthy diet, packed with vitamins, minerals, and antioxidants. However, for transplant recipients, some fruits can pose certain risks. After a transplant, your body is working hard to adjust to the new organ, and we prescribe immunosuppressants to prevent rejection. Certain fruits can interfere with your medications, affect your potassium levels, or even increase your risk of infection. So in this video, I am going to guide you through the specific fruits that transplant patients often need to avoid or consume with caution. Let's get started. Let's talk about grapefruit. Now, grapefruit is generally touted for its health benefits, but for transplant patients it can be a bit of a troublemaker. The culprit is a compound called furanocoumarin, found in grapefruit and its close cousins like Seville oranges and pomelos. Furanocoumarins interfere with a crucial enzyme in our liver called CYP3A4. CYP3A4 is responsible for breaking down many medications, including those crucial immunosuppressants you're on. When grapefruit juice inhibits this enzyme, it can lead to a buildup of medication in your bloodstream, potentially causing serious side effects. This interaction is particularly concerning with calcineurin inhibitors, a common type of immunosuppressant. The consequences of elevated drug levels can be severe, ranging from tremors and kidney problems to an increased risk of infections. So the bottom line is, after a transplant, it's best to steer clear of grapefruit, Seville oranges, and pomelos. And trust me, there are plenty of other delicious fruits you can enjoy. Potassium. It's an essential mineral, crucial for muscle function, nerve transmission, and regulating your heartbeat. But like many things in life, balance is key, especially for transplant patients. Some fruits are naturally high in potassium, and for someone with a healthy kidney, that's not a problem. However, post-transplant, particularly if you've had a kidney transplant or have existing kidney issues, your potassium levels need to be carefully monitored. High potassium levels, known as hyperkalemia, can put extra stress on your kidneys and potentially lead to irregular heartbeats, muscle weakness, and other complications. So, which fruits should you be mindful of? Bananas, while a popular choice, are relatively high in potassium. The same goes for oranges, melons like cantaloupe and honeydew, and even some dried fruits like prunes and raisins. Now, I'm not saying you can never have these fruits again. The key is moderation. Instead of having a whole banana, perhaps opt for half. And always, always consult with your transplant team or a registered dietitian. Let's talk about sugar. After a transplant, you're at an increased risk of developing diabetes. This is partly due to those incredible immunosuppressant medications you're on, which can sometimes affect how your body regulates blood sugar. Fruits like mangoes, pineapples, and grapes, while delicious, are on the higher end of the sugar spectrum. And while a little treat now and then won't hurt, overdoing it can lead to those dreaded blood sugar spikes. So what's the solution? Balance and portion control, my friends. Instead of having a whole mango, perhaps enjoy half and pair it with some protein or healthy fats to slow down sugar absorption. Choose a smaller bunch of grapes and be mindful of dried fruits like dates and figs, which are naturally very concentrated in sugar. By being aware of the sugar content in different fruits, you can make choices that support your health and well-being after your transplant. We all know that washing our fruits and vegetables is important, but for transplant patients, it's not just good practice, it's crucial. Your immune system is working hard to prevent organ rejection, and that means it might not be as quick to fight off infections. Raw or unwashed fruits can harbor harmful bacteria, fungi, or parasites that wouldn't pose a threat to someone with a fully functioning immune system. Think about it. Those fruits have been handled by multiple people, transported long distances, and might have come into contact with soil or water containing microorganisms. We're talking about things like Listeria, Salmonella, E. coli, and even Toxoplasma gondii, a parasite that can be particularly dangerous for those with weakened immunity. So what's the solution? Simple: wash your hands thoroughly before handling any produce. Use running water and a vegetable brush to scrub the surface of fruits like apples, pears, and berries. By taking these extra precautions, you're protecting yourself from potential infections and giving your body the best chance to thrive. Now, I know how tempting it can be to try exotic fruits, especially those beautifully vibrant and unique varieties from far-off lands. And while they can be a delicious and exciting addition to your diet, after a transplant, it's best to approach them with a bit of caution. Exotic or imported fruits might carry pathogens that are uncommon in your local environment. Your body might not have the same defenses built up against these unfamiliar microorganisms, making you more susceptible to infection. Additionally, the regulations and standards for pesticide use and food handling can vary widely from country to country. So, while that dragon fruit or rambutan might look incredibly appealing, it's best to stick with fruits grown locally and in season. If you're unsure about a particular fruit, don't hesitate to ask your transplant team or a registered dietitian. Finally, we come to starfruit, also known as carambola. While most fruits on our list require moderation or careful preparation, starfruit is one that transplant patients, especially those with kidney issues, should avoid entirely. The reason is a naturally occurring neurotoxin called caramboxin found in starfruit. For individuals with healthy kidneys, caramboxin isn't usually a problem. Their kidneys filter it out efficiently. However, if you've had a kidney transplant or have impaired kidney function, your kidneys might not be able to remove caramboxin effectively. This can lead to a buildup of the toxin in your bloodstream, potentially causing neurological problems. The symptoms of starfruit poisoning can range from hiccups and vomiting to more serious complications like seizures, confusion, and even kidney failure. So it's simply not worth the risk. If you're ever unsure about a particular fruit, always err on the side of caution and consult with your transplant team. So there you have it, our guide to fruits that transplant patients should avoid or consume with caution. Remember, this video is not meant to scare you, but to empower you to make informed choices about your diet. A transplant is a precious gift, a chance at a healthier life. And by being mindful of your diet and working closely with your healthcare team, you can enjoy a delicious and nutritious variety of foods while keeping your body strong and thriving. If you have any questions or concerns about your diet after a transplant, please don't hesitate to reach out to your transplant team or a registered dietitian. Thanks for watching.